Being a psychiatric nurse is meaningful because you know that I get to help all of these people. I get to touch their lives in some way, in a positive way. No matter what is going on with a patient, what mental illness they have, they're all just human stories. You know, I mean, we all have things that we are cross to bear, so to speak. So I like hearing what those stories are, and then also trying to provide some support in some way. I know that I think the nurse we're part of a greater team of people that help out. So by no means do I think it's always the nursing team that you know, does everything, but we are definitely the people on the front lines, giving them that one-to-one support they need in those moments of crises. And sometimes when a patient is in a lot of distress, they can become more aggressive, and this was a case where she had come in and started flipping over furniture. And so obviously that's a big red flag, and we were very concerned about that and where she might escalate from there. But I knew that this patient had never done anything like that before. So also, you know, you're thinking about their history and, you know, do I want to call what we call here a show of support, where a huge number of people come to provide that extra support? Do we want to do that, or do we want to just try to, you know, utilize our nursing skills, see if there's things we can do to help them calm down? Maybe that's various coping skills they've used in the past. And so we're thinking about all these things in your head of what you can do for this person. And she, because I knew she didn't have that history, I really didn't want to have to call a show of support because I didn't want her to be embarrassed and I didn't want her to feel traumatized in any way. So I just spent a lot of time talking with her, listening to her, asking her questions, trying to get her to share with me what was going on in that moment. And so eventually she did start to calm down, and we didn't have to medicate, which we would normally do, potentially do as well. We did not have to call a show of support, and she just kind of eventually started to calm down and talk, and was able to journal her feelings. And then we just provided some extra support by staying with her, just kind of hanging out with her a little bit more. She said something like, you know, you always know when I'm having a bad day or when I'm feeling badly, and you always show up in just the right moment. And so that was pretty gratifying to know that, wow, she's, you know, she really understands that, you know, I'm there to support her, and it was helpful for her. After that, she left, and she's, from everything I know, she had a good experience here, and she's gone on and things have gone well for her. Out of that rapport can come the trust that it takes to build that therapeutic relationship, but also kind of like with the patient I mentioned before, that all of that leads to them trusting you. And then all of those things that build trust, it adds meaning, but it adds meaning because you know that you're helping them in some way.